Hello, I am Padmini Balagopal, International Board Certified Lactation Consultant. I'm here today to give you an overview of feeding for all the mothers-to-be. Congratulations to you. And here's hoping that you have a smooth, easy delivery and you go on to become wonderful, wonderful mothers. Having said the introduction about myself, before we proceed and I talk about breastfeeding, I would like to tell you that I'm going to present the overview of the topic, but I'm sure that have been coming yesterday and again today on web chat. Those questions pertinently at the end of the session, I'm sure. And let us begin with that. Babies' issues of nutrition and preventive health are ideally solved. The value of breast milk has never been copied and probably can never be. Why? Because every mother makes this milk specially tailor-made for her baby. The baby is born. The mother makes a milk that is specially suited term or full term. Now, if there is a preterm baby, that milk immediately changes and becomes high in protein, iron, and special fatty acids, and lower in fat so that it can be easily digested by the and helps in the baby's quicker catch-up growth. What is it that makes breast milk so special? Just shown us that mortality is lower at all ages. These babies get sick less frequently. And even when they get sick, it seems like they have built-in immunoglobulins to protect them. Respiratory illnesses like asthma are lower. And infections like ear infections, meningitis, diarrhea, respiratory infections, all these are much less in that breastfed baby. When we go on to other benefits, it is easily assimilated by the infants and the child's body. How is it so suitable for the baby? It's perfectly suited for that gut that does not have any, it's been a sterile gut. The food tube has been sterile, and the mother, it has been found that the mother's milk carries a lot of good that will populate that gut so that allergies are less and antibodies are high. More benefits. Secretory immunoglobulin A is only available. This is an immunoglobulin that helps to protect that baby. It's available through mother's milk only till 6 months. Then when the baby is drinking the milk, the jaw and teeth and speech development are all, dentists love the breastfed baby because the teeth are wide, spread, and not so crowded, and less chances of malocclusion, of psychological bonding. Because when that baby is drinking, he's going to drink as much as he or she wants and then come out on her own. There's no force feeding as happens with a bottle. This can affect future obesity, diabetes, type 2 diabetes, and definitely they have found that there's less chances of ear infection because there's nothing pouring at this angle. The baby is at a very different angle when the baby is breastfeeding. Milk is a boon for that baby. The duration of diarrheal illnesses are almost negligent. These babies stool more often. They're almost never constipated. Their protection against something known as necrotizing enterocolitis, which is a diarrhea that happens when the baby is very young. And there's a lot of other benefits like less urinary tract infection and a reduced risk for autoimmune diseases, bowel disease. What about SIDS? Have you heard of SIDS? SIDS is sudden infant death syndrome. This has been found to be less with a breastfed baby. Also, there's improved visual acuity and psychomotor development, which may be caused by, that you may have heard about, DHA. It has been attributed to this for improved visual acuity for that baby. And I'm sure you've heard it said that that breastfed baby has a chance of having 10 to 15 points higher than a baby fed any other way. Why? Because is the breast milk so suited for cognitive and brain development, but also it's the higher stimulation that the baby gets from breastfeeding has been a factor. Now, let us go and see. I'm going to show you a picture of the baby. Almost always, this baby is closed, and this makes sometimes the mothers think, is the baby sleeping? No, they're so satisfied with the drinking that they are going to be sleeping, but drinking all the time. What are the benefits for mom? The mother, menstrual cramp-like pains the first time she breastfeeds. Why is that? Because the oxytocin that breast milk also helps involute the uterus, helps the uterus go in, and she gets back to her original shape quicker. There's a lot of maternal empowerment. She feels so empowered that she's feeding her baby. And it's an easier and more involved but fulfilling process. These babies sleep more restfully, so she can sleep also. There's a lower incidence of breast and ovarian cancer for the mother. Of course, there's a lower cost and fewer sicknesses that's going to keep the mother awake at night. What about the employer? Well, if there's fewer sicknesses, there are fewer reasons for the mom to call in sick, that my baby is sick and I cannot come. This almost always makes the employer very happy. And the proactive health attitude. Remember, there was a slogan, it takes a village. The whole family and the village and the support system that the mother gets goes towards making a very happy mother and baby dyad. Now let's go on to see some other benefits. There have been reports that the milk that has been rich in minerals like calcium, phosphorus, and zinc seems to lay the framework for a good bone structure in the baby. Now, what about the psychological cognitive benefits that I was talking about? There is something to do with the skin-to-skin bonding that the mother and baby have that makes this baby so much more alert and so much more cognizant. Now, let us go on to another area of how the mother and baby will breastfeed. You may have a lot of questions. How will I know my baby is getting enough? That's almost always a frequent question I get. Will I suffocate my baby when I bring the baby in? Why does my baby push away while I'm latching? Can I lie down and breastfeed? How often does my baby have to burp? What role can my husband play in all this? Then I have a frequent question, must I be on a special diet? Or I do not have enough milk? Or my baby goes to sleep very soon at the breast? Each and every one of these questions has a solution and a closure to your satisfaction and to the baby's satisfaction. What are the signs to know that breastfeeding is going on all right? There's more suck and swallow. Suck and swallow. Instead of suck, 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 swallow. Suck, 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 swallow. When the baby is doing a lot of suck, 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 swallow, that means he or she is getting a drip, a drop, a drip, a drop. This isn't going to make a happy baby. When you put the baby back in the crib, he or she is going to let you know, hey, listen, I'm not full yet. So you need to look and watch out for the signs of how the baby is drinking, and that comes very easy. Not the first day, but when the baby is born, it's not that there's a faucet that's open and milk is going to pour out. That doesn't happen. Most often I get the question, I didn't have milk. The more the baby sucks, I'm going to show you the figure of a breast. The more the baby sucks, the more milk this breast makes. There's a cycle between the brain and the breast. And the more the sucking occurs, the brain sends a message to the breast to make more milk. So sucking is what gets the milk to come. So the first day, make sure that you have a few cues that I'm going to give you. Ask that the baby be kept on you, skin to skin, for the first hour. It's called the golden hour. Why? Because this is when the baby and mother are bonding. This is when the baby is awake. After that, the baby goes into a sleep mode. So we want to capture that moment. And when the baby sucks, bring the baby to your breast every hour, hour and a half. Let the baby suck. But remember that what comes out on the first day is called the colostrum. Very thick, like condensed milk, that keeps the baby satisfied. The baby's stomach is so small, doesn't need a whole lot of milk to satisfy, but he or she will be more satisfied with the sucking at the breast. Towards the third, fourth, and fifth day, watch and make sure that there are 6 wet diapers. That tells you only if it goes in, it's going to come out. So that tells you the baby's got milk in. The normal stools are semi-solid, and the color of mustard and mixed in water is how eventually it turns from the black to the brown to the green and then yellow. Then another sign that the baby is getting enough is the baby is going to act contented between feeds. And of course, the mother, as I told you, experiences uterine contractions because that oxytocin that's bringing the milk out to the breast is also a hormone that makes the uterus contract. And eventually, the baby gaining weight will tell you that the baby has got all the baby needs from you and through breast milk. Positioning the baby is very important. There are many pillows and feeding pillows. Do you need one? You don't. But if you want one, this is the kind of feeding pillow I would suggest you get. No make or anything, but just a platform. And you bring it out and you bring it to around you. And when you bring it to the level of the breast, you do not have to bend down to feed the baby. The baby comes to the level of the breast. And there's something known as a donut pillow. That's not so convenient. This is better. And do you need it? You can prop your baby up with 2 pillows and not buy one of these. Now, how do you know a baby is well attached to the breast? After you bring the baby up, seat yourself comfortably with a pillow behind your back and a feeding pillow. Bring the baby. The baby's stomach should be facing the mom's stomach. So he's lying on his side or she's lying on his side. And at that point, baby's mouth with the nipple. Remember one golden rule. There is no milk in the nipple The milk is all around the breast. So when the baby sucks at the nipple, it's going to hurt. And the baby is only going to get a drip or a drop. Make sure that when you bring the baby to the breast, tease the baby's mouth with your nipple. The baby is going to open the mouth. When he or she opens wide, give a quick hug, and this is how the baby will drink. So the baby is not nipple sucking, but so the milk comes out from the breast. So nipple feeding is what causes pain to the mother and does not give enough milk to the baby. So, but whereas when the baby is on open mouth around, it's a win-win situation. Then let's go to the positioning. When you have positioned the baby and the baby has started drinking, watch for suck, swallow, swallow, or suck, suck, swallow. Doesn't matter. There's one rule in breastfeeding, no rules. Every baby is different from one baby to another, from one feed to another. So, but make sure that the baby is drinking. And if the baby doesn't get enough milk, he or she is going to let you know. When the baby opens wide, give a quick hug. And when the baby is sucking, you can just relax, take a deep breath, and because you should not have any pain, you can enjoy the process of breastfeeding. If there is pain, put your finger in the baby's mouth, break the suction, take the baby out, and relatch the baby so there's a wide open mouth around the breast. Now some mothers may have a wide areola. This is called, the lighter part is called the areola, and the darker part is the nipple. Now some mothers may have a wider areola. Does a baby have to cover the whole areola? Not at all. As long as the baby's chin is against the breast and drinking, and there's no pain, and the baby is drinking, that's sign enough that breastfeeding is going on well. How soon after childbirth? When no drugs are used and the childbirth is natural, immediately, skin to skin. Remember that golden hour. Ask for your baby to be put on your skin to skin, with no blankets or anything in between. That process, WHO, World Health Organization, has found out that these babies interact more. You have a more successful breastfeeding session, and they are very alert to the mother and the mother's skin and the pheromones that the mother is secreting. When the baby is on skin to skin, you stroke the baby, and then when the baby is ready, you can latch the baby on, make sure there is no pain. Now, how long should you feed the baby? Is it 10 minutes, 15 minutes, 40 minutes? Again, there's no rules. Some babies will drink quickly. Some babies, the older baby learns to suck efficiently and take the milk and come out. But the young new baby may take a longer time. What I would caution is, as soon as the baby is on the breast and the baby is drinking and everything is going very well, the baby might get drowsy within the first 5 minutes. I do not think that mothers at that point will think that that's the end of breastfeeding, but just a cautionary note for you, don't think that's the end of breastfeeding. They wake up at that point when they're drowsy and they've dozed off, take the baby, burp the baby, bring the baby back again, latch the baby on, and the baby will go to it. Sometimes it takes about 30 to 40 minutes, and the baby will be suck, swallow, suck, swallow. How frequently do they nurse? The beginning, I would say maybe every 1.5 to 2.5 hours. So when the baby is dozing off, that's the cue for moms to doze off too. Because understand, this process of breastfeeding initially will go through the day and night. So you need to take your cat naps also at that point. And now let's go on to the next process of when and what are the signs that I look for to see that my baby is hungry. That's sign enough. When the baby is crying is already a last sign. You don't have to wait for the baby to cry. If it's as soon as the baby is drooling, that's sign. I would suggest you bring the baby on before the baby gets very agitated and crying and very hungry. Bring the baby on at a point when you can latch the baby conveniently and comfortably. What about the mother-child dyad? What happens after the baby is born? Most hospital facilities today allow rooming in. And most doctors and staff are very pro-breastfeeding, or every pediatrician that I have ever met is always pro-breastfeeding. And staff are very helpful. If there are medical problems that can affect the breastfeeding, they have to be worked on. Hopefully, the attitude of the family is very good, and they will all be supportive of their breastfeeding mother. Sometimes I've seen that when a lot of visitors come soon after to see the baby, that sort of seems to affect the breastfeeding process. I would suggest let the grandma, the grandpa, the dad, all of them work on talking to the visitors, but let mom and baby on together so that there is a good breastfeeding session. And the future plans of the mother, when the mother is working, can she breastfeed? Of course she can. Remember, we can work on taking a little thermos bag with a few bottles and a pump and tell the management, I'm going to pump every 2 hours. And through lunch break, you can pump, bring the 3-4 bottles home and let the baby feed from you all night, all evening and night. Next morning, take fresh bottles, and that's how breastfeeding occurs. How long should you breastfeed? The WHO, the American Academy of Pediatrics, one has suggested at least 6 months of exclusive breastfeeding in the baby's mouth except breast milk. Beyond that, the weaning foods, the complementary foods, other feeding can continue. For how long? It's a mother and baby decision, usually about up to 2 years or more. Where are some of the common breastfeeding problems? Poor positioning, poor latch, not waiting till the baby is finished, but finishing up because you had to go for another appointment and keep the baby half. Cracked nipples can be very painful, should not occur, and should be corrected as soon as possible. Tired, when your mom is too tired. Anatomical problems in mom or baby. Now, do you have to drink milk to make milk? Let's go to diet. But you have to drink a lot of fluids. We have the ability to convert water to milk to feed the baby. And so drinking, and you will feel thirsty. There is a common rule: eat to comfort, drink to thirst. Eat when you're hungry. Foods you can have. I think it is wonderful. Oats for breakfast with nuts and raisins is nice, if you favor that. Lunch, whatever you would like, but make sure you have a good amount of vegetables and fruits and a balanced diet of protein and carbs. Other part of it would be where we often find a big missing piece to the puzzle is when the mom feels that she's not on a good diet and maybe she will not make milk, or she squeezes her breast and sees the beginning is very thin, and then she compares it to formula. It's like, no. The beginning part of the breast milk, the foremilk as it's called, will be watery. That's to take care of the baby's fluid needs. Halfway through or midway, the milk changes to high fat. That will take care of the baby's calorie needs. To worry about her diet? Not at all. If you're eating a wholesome diet, that should be enough. And I can now answer some of the questions that have come up. Let me see. One of the questions what are the things I can do? I'm 30 weeks pregnant to have flawless breastfeeding. I appreciate your question. When I would suggest you go visit your gynecologist with the information that you're going to breastfeed, and then ask her to see your breast, the nipples. They're all well formed. But stimulating your nipples to make them come out is not advisable without the advice of your gynecologist. Only she can decide for you any step you should do prior to childbirth. Mother feed her baby immediately after birth. Of course. There's a globalhealthmedia.com has a lot of videos where the baby the vagina and crawls by himself or herself all the way to the breast and latches on. Absolutely. Now let's see another question that you may have. About how long will I have to breastfeed? In a breastfeeding session, as long as the baby is drinking actively to breastfeed, but without pain, and the baby will come out, or after 30-40 minutes doze off and not show any interest in breastfeeding. That's the end of the breastfeeding session. How do I take care of cracked nipples? Well, cracked nipples, first of all, you have to make sure that the next feeding session does not involve pain, because that can make the cracked nipples worse. Taking care of the latch and making sure that it doesn't pain at the following breastfeeding sessions. How do you take care? Take 2 bowls of lukewarm water, about half a teaspoon of salt, mix it in and soak the 2 nipples there. And that's very soothing, and that can take care. Again, your own milk has the medicines to that the healing has taken place, as long as it's not repeatedly and successively getting cracked. So the cracked nipples first have to be taken care of by proper latching, and then you can take care of the pain. To breastfeed the baby with the breast implants? Yes, but it depends on the kind of surgery you've had, and it's very individual. Work with the gynecologist and the lactation consultant. My breast nipples are too short. What should I do? This is what I was saying at the beginning. Sometimes too short, or they feel they want to pull it out. This kind of nipple stimulation can precipitate contractions, but that's why I suggest you talk with your gynecologist. And then if your nipples are too short, can you breastfeed? Of course you can. Is feeding equipment or feeding milk a refrigerator? The breast milk, if your room is not too warm, can stay for about 4 or 5 hours. Longer, but because we are in a tropical country, and we're in a hot season, I would say 4 to 5 hours, as long as it's not on a sunny window. Then if you want to store it for a couple of days, a refrigerator, as long as there's no power outage and the temperature is maintained. Take the milk out and you're ready to feed within the first 2 to 3 months. We suggest that the baby not be given a bottle because there could be some nipple confusion. Cup fed, or could be fed with a palade or a spoon, but I would suggest to work within 6 weeks. Establish breastfeeding very well, and then you can start the bottle. Work with a lactation consultant for guidance so that you can that the pumped milk, you would start pumping your milk about 2 weeks prior to going back to work and storing the milk. How do you store your milk? You can store the milk in the freezer. Keep a block of ice cream and make sure that that ice cream is rock hard. That's an indication that your freezer has been cold enough to hold that milk. And when you bring it out, take a large pan of lukewarm water and put your breast milk in a smaller pan and swirl it around till it comes to room temperature. And then you can feed that to the baby. How do I prepare myself for feeding? Just be ready. You're feeding your baby. How do you prepare? Nothing, no preparation necessary, except that you have to make sure there's no pain and your positioning is all right and the latching is good. You're good to go. Now, there is an infection that the mother has talked about, and I would suggest please talk to your gynecologist because that's an individual situation, and I should not be taking any decision on that. How long should a mother breastfeed? By long, if you mean the length of time during a breastfeeding session, that I have answered, but I'll answer again. As long as the baby is sucking and swallowing. If the baby is doing he's just sucking and not drinking meaningfully, it could be that the baby is done, or it could be that the baby's not getting enough milk. So you need to make sure that the breastfeeding session is successful and the baby has been really drinking. And then you can take the baby off and put the baby on the crib, or if he's ready to play or she wants to sleep, whatever. But how long? 6 months exclusively breastfed. Babies are very healthy, and up to 2 years or more, depends on the mother and the baby. It's a joint decision. My nipples are having a burning pain. What do I do? Again, I'm going to tell you that if the nipples are having a burning pain, watch for the time that your breast, at the process and at the moment you're breastfeeding. How is the baby on? Is the baby sucking at the nipple? That's going to hurt. You want the baby's mouth around the nipple, not using, this is just a faucet. It's a faucet, a vehicle through which the milk flows. This is not going to, yanking at this will not pain. The baby's mouth should be wide open. How much time do I need to recover after a C-section? That would depend. As soon as the mother is out of anesthesia and the doctor says she can breastfeed, we have held the baby right up to the mother because she cannot turn, she's in pain, and the baby is breastfed very, very soon after. It depends. It's both as an individual situation, and a doctor would have to decide about the anesthesia. When will I get milk in my breast before childbirth? Before childbirth, some mothers have had milk come out, but that's, the hormones are getting ready. It's the process of the placenta being taken out of the mother's body that starts the oxytocin and the prolactin actively to produce breast milk. Milk production after delivery. My baby is a month old. Now, that I would need to see what's happening. A lactation consultant would have to work with you on how often the baby is feeding, how long the baby is feeding for at every session, and why is there usually the breast and milk that's produced is regulated to the baby's needs. If there is nothing else interfering and the baby just drinks to his hunger and she comes out, there should be nothing else overriding the situation and say that you should have, and that makes you feel that you have to increase your breast milk production. When you store your milk, remember to use the FIFO section, FIFO rule. First in, first out. You date every container of milk that you've taken and put it in. The first containers that were put in will be taken out. The later containers will be taken out later. If there is a problem in breastfeeding after baby's birth, we have to watch and see why. And usually, the baby's suckling makes the milk come out very well. There is some discharge of milk before delivery for some people, but that's not of any concern, not for you to worry about. Bring it to the gynecologist's notice. Nowadays, most of the women lags in breastfeeding after baby's birth. In what way should I avoid these difficulties? What do you mean by lag? Let me tell you what I understand by that question. When breastfeeding does not occur right away. When this happens, usually it's because mothers are supporting a system, family, or someone else feels the milk hasn't come out, the baby's come out, the milk hasn't come out. As I explained in the beginning, there is no faucet to open that the milk pours out. The baby suckling at the breast is what makes the milk get secreted. So put the baby to the breast as soon as the baby is born. Every 1 to 1.5 hours, the baby will be perfectly satisfied. Go to sleep, drink a little colostrum, then go to sleep. Remember, the colostrum is thick like condensed milk, and so that should usually keep the baby satisfied. But the baby may want to come back and suckle frequently. That's all. That's how you avoid difficulties on lagging behind. I feel pain in my stomach, like the period. That's exactly what we were talking about. It's your uterus going in. You're getting back your shape because that very oxytocin is getting your uterus to contract so that it goes back to shape like pre-pregnancy weight. If a mother has infection, can she feed the baby? Of course. It depends on what kind of infection. So I would defer that judgment on to the point where the infection, if it's just a cough or a cold, long before you got the cough and cold, the germs were there, the baby has been protected, not to worry. If there's other infections that you are concerned about, talk to the doctor, and the lactation consultant, pediatrician would be able to help you with that. Will engorgement happen to everyone? Engorgement. What is engorgement? The normal breast, when it really gets engorged with milk, filled in with milk, and the baby is not drinking adequately, that's when engorgement and painful engorgement can occur. This doesn't have to be. It can be avoided, prevented by not giving the baby any other supplements but just breast milk. And the baby drinks every time the baby is hungry. Now, what is the next question? I heard about cluster feeding for comfort, and some babies feed every 15 minutes for a few weeks. Is that normal? Cluster feeding. By cluster feeding, you mean coming back every 15 minutes? I would check on how the baby fed when the baby was feeding. Did the baby do meaningful drinking, or the baby was suck, 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 swallow, suck, 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 suck? Then he's going to come back. He's going to want to cluster feed. She's going to want to feed more often because that didn't fill her up. So that's what you have to check out. Will every mother get milk after delivery? Yes. The body physique is programmed for that. Mother breastfeed. Technically, almost every mother, 99.99% of mothers can breastfeed. There may be a situation where a mother cannot breastfeed. That will have to be taken on an individual basis. How do I take care of the cesarean? Try and do a football position. What we do after a C-section is feed the baby, like bring the pillow to the side so the mother's stomach is left unencumbered and the baby is feeding from the side. That can be done very well. Are there any other questions that we have? What's the frequency of breastfeeding for the baby? Remember what I had said. The only rule is there are no rules. How soon will we know that baby's hunger has decreased? The baby, when he drinks or she drinks, sucks, swallows, sucks, swallows, will enjoy the process, and so will you. And maybe after 30, 40 minutes, the breastfeeding will be finished. The baby may come off. My baby sleeps for 4 hours at a time. How do I feed him? How old is this baby? Is the baby older? If the baby is just born, 4 hours is too long a period for a baby to be not to be feeding. So there are some babies who are going to say, my mom's going to come and feed me. My mom's going to come. She'll wait patiently. But that's not what we want. We want for you to make sure that the baby is feeding adequately, especially soon after childbirth. So, no, 4 hours soon after childbirth, I wouldn't worry about that. I would suggest you make sure that you wake the baby up, put the baby on your shoulder. Burping the baby is very important, especially in the beginning, because the baby's gut has been a sterile tube, and along with the milk, there may be an air bubble that went in. So getting the air bubbles out, allowing the baby to burp soon after you take the baby from the breast will be very helpful. The stomach becomes less distended and less uncomfortable for the baby, and the baby sleeps well. So remember to burp the baby. Do we have to feed with alternate nipples? You don't want to switch breasts every 5 minutes. No. Remember, the first milk that comes out is very high in water content. That's to take care of the baby's fluid needs, hydration needs. So we want that baby to get that milk. But halfway or somewhere in the middle, the milk turns to a high fat. We want that baby to get that high fat milk too. So you do not want to switch breasts frequently. You can feed from one side and after on one feed, or you can switch breasts after about 20 minutes, 25 minutes, and the other side feels engorged. You can help, the baby can help relieve that stress. How will I know my baby is well fed? And don't I need to give him a top feed? What is his top feed? I don't think at all. That's where the problem can begin. For hundreds, millions of years, for so many years, centuries, we have come without any top feed. Mankind has survived without that top feed. If there is a particular situation that the doctor, pediatrician feels, that is not what I'm talking about. The regular feeding should not get any other milk, but just your milk. Exclusive breastfeeding. They call it EBF, exclusive breastfeeding. That ensures that the mother is getting enough milk secretion to feed the baby for as long and as much as the baby wants. Now, let me see another question. I heard many people say, I didn't get milk. when people say, I didn't get milk, when a mother soon after childbirth squeezes her breast and tries to get some milk, nothing is going to come out. It's only when the baby's lips come and touch the breast that the nerves are conveying. Remember, the brain-breast cycle. Immediately the brain gets a signal. There's a baby there. And the mother's brain is sending signals out for oxytocin and prolactin to get the milk secreted for the baby. Yes, soon after delivery, every mother should be able to secrete and breastfeed. What else? In 20 days, he sleeps a lot in the morning and afternoon. How can I feed when the feed that he's enjoying is very happy to feed? Then there's some babies, their circadian rhythm they're awake in the day and they sleep at night. But there are other babies who are awake at night and sleep during the day. But that will soon change, I assure you. In my first pregnancy, I got bad cracked nipples. My mother-in-law told me to apply ghee to cure it, but it really took long. Is there any other ointment to help? I'm so glad you asked that question. Your own milk has medicines to take care of the cracked nipple. But remember, to prevent the worsening of the cracked nipple, make sure that the next latch, when the baby is on, is pain-free. And then the nipple heals by itself very quickly. How do you increase the productivity of milk? Simple. The more the baby feeds, the more milk you make. As the babies grow, the milk production will also increase to keep up with the growth of the baby. Should you be breastfeeding beyond supplement when you started table foods? It's your decision, but the baby may love the process of breastfeeding and would like to feed for about 2 years maybe. What about how long can the milk be kept in the refrigerator? For about 2 to 3 days, as long as there's no power outage and it doesn't get warm in the refrigerator, and that should be all right. When should I alternate my breasts? As I told you, every time, not necessarily, but you need to make sure that the baby is fed well on the side, and then you can bring the baby to the other side. How do you wake a sleeping baby? Wonderful question. Wonderful question. Well, how do you wake a sleeping baby? Baby sleeps almost 22 hours, 20 hours in the day. Now, sometimes the previous feed may have been so satisfying that the baby can sleep through that. I'm going to suggest take the baby's mouth and let the baby suck on your finger. Aim your finger to the roof of the mouth and let the baby suck on the finger. First, the baby will bite, and then it'll start sucking. The baby is awake. Then you can bring the baby ready. The baby is ready to go to feed them and to get a mom's milk. What should be done if the milk is not enough for the baby and the baby is not putting on weight? We need to see how the baby is drinking, because this can be an ongoing, continuous problem. If the method of feeding has been like nipple feeding or not been feeding well, then it can go on. You're most welcome. Someone has just written, that question was good. But where you have to make sure that the baby's weight is growing according to standards is when you find out how the baby is feeding at every session. Make sure that you are feeding actively and the baby is drinking actively at every session. Is only breast and milk enough for a baby till he turns 1 or 2 years for their development? No. Up to 6 months, exclusive breastfeeding. Beyond that, we would start the baby on, and here's what I'm going to suggest. Start rice cereal. It's very hypoallergenic. Cook the cereal, mix a little breast milk with it, and then you can give that to the baby. But between one new food and the introduction of another food, after 6 months, give a break of 1 week. Let the baby's gut get used to the new food that you've given, and then the baby will be ready. What if the baby sleeps while getting fed? I think I would love to show you a picture of babies who are breastfeeding. Sometimes they're awake and looking up, but most of the time their eyes are closed. But that does not mean they're sleeping. But if they're sleeping and not actively sucking, take the baby off, burp the baby, and bring the baby on. That's a good question, because many people think that sleeping at the breast, in spite of sucking, it means it's not enough. If the baby is but closing the eyes and appears to be sleeping, that's all right. The baby is getting milk, as long as that drinking, sucking, and swallowing is happening and taking place. What are the signs of milk production during pregnancy? You're not going to get any signs. You're not going to, your body is not going to talk to you. Your breasts will start enlarging. You'll get into a bigger bra. You'll need a bigger bra maybe. But other than that, I don't think you're going to get any overt signs of milk coming out. No. Now, after 6 months of feeding, how many times do we breastfeed the baby? Breast milk. Right? I would suggest keep on to your breastfeeding routine. Give cereal in the morning. First week, the first time you're introducing solid foods. Then the next week, try and give in the morning and in the evening. Slowly increase it to the point where the baby is comfortable and the baby will want more solid foods. The interest in eating solid foods. About 6, 7, 8 months, the baby is going to already be introduced to a whole slew. Where after rice cereal, try ragi, try oats, cook it, blenderize it, mix it with milk, but no sugar. Their milk does not need, you did not sugar your breast milk. No milk has to be sugared. Not now, not ever. You do not need to add another drink to make the milk tasty. You have not done it for the first 6 months. You don't have to do any adding to the milk. So let the baby continue to drink. The best gift we can give the baby is not to get the baby addicted to a high sugar load. And just giving the baby plain cereal mixed with your breast milk, plain vegetables cooked and blenderized and given to the baby. Fruits, stew an apple, take the skin off, pulp, make a pulp of it and give that to the baby. About 7, 8 months, when the baby is ready, give some finger foods like carrot sticks, boiled carrot sticks that the baby can take and chew. He will want and she will want to do that. When you're ready to feed the baby and the baby is ready to have table food along with the other adults, you spread a whole big sheet below and give the spoon and a little plastic fork. Remember, when you buy plastics, it should be Bpa-Free. And because we do not want that in the plastic. And give that in a plate and put some food and the baby will start eating, because the baby is going to mimic you and everyone else at the table. Is there a myth that when baby is suffering from motions, everybody says to stop breastfeeding? Is suffering with motions? What do you mean by suffering? A lot of bowel movements? These babies are breastfed babies are never constipated. They don't give just once a day. They will be going frequently and more. But I would look into the situation individually. If there's a lot of motion like diarrhea and pain in the stomach, we have to worry about infection. The baby may be exclusively breastfed, 4 months old, but getting diarrhea could mean the baby put something or some infection happened to come into the baby, which has to be corrected. But usually, there's a breastfed baby does not get just one motion. Frequent motions is a order of the day. We have what is known as a Nipple, which is post breastfeeding in Chennai, and post discharge from the hospital. You can call and we Skype. We do telephone consults, but we are there to address every problem or question or issue you have in breastfeeding. And you can, I think the telephone number and the email for this center will be provided so that you can access it and you can ask your questions. I enjoyed the session with you because I love talking about breastfeeding babies and breastfeeding moms, and I'm always there should you have any question. Oh, there are 2 more questions. Please, let's go. Any specific food to increase milk? Well, Dr. Hale in America has studied a lot of galactagogues. There's milk thistle, there's ashwagandha, there's lactare, there's tablets. Ideally, the plain natural way to increase milk is to breastfeed more frequently. Then you're producing more milk, drink a lot of fluids. Should we need to be concerned about taste? I read somewhere that it should not be sour. Milk? If you're drinking adequate water, well, even otherwise, the milk, breast milk is almost always uniform and standard. It doesn't change because you had ice cream. The breast milk doesn't become sweet. Or you had very spicy food. The breast milk doesn't become spicy. The breast milk is a uniform standard milk. I thank you for thanking me. I like that comment. And we're always here. Remember, when you get discharged from that hospital, you are not alone. There's plenty of resources you can go to. And the only wrong question is the question you didn't ask. Feel free to ask every question you may have. And I am always there through Milk Center. And thank you again, Padmini Balagopal.